Hey everyone, and welcome to another deep dive. Today we're going to be exploring something pretty fascinating, a tiny gland that plays a huge role in our bodies, the thyroid.
It's true. The thyroid, despite its size, really does have a huge impact on our overall health and well-being.
For sure, and whether you're a medical professional, a student, or just someone who's curious about how the body works, I think you'll find this deep dive pretty interesting.
Let's start with the basics. The thyroid is located right in the front of your neck, below your Adam's apple.
Below the Adam's apple. Okay, so when we talk about the thyroid, we're talking about this kind of like butterfly-shaped
Yeah,
gland.
exactly. It has two lobes connected by a thin band of tissue called the isthmus.
Oh, right, the isthmus. And it's all kind of tucked away in this protective layer, this fascia. I remember learning about that in anatomy class.
Yeah, it's called the pretracheal fascia. It helps keep the thyroid in place and protects it from damage.
I always thought it was pretty wild how the thyroid actually starts developing in the back of the tongue during fetal development.
It is pretty amazing. It migrates down to its final position in the neck as the fetus grows.
It's like it goes on this little journey before settling in. And speaking of settling in, you mentioned that the thyroid's location is super important.
Mhm.
Why is that?
Well, think about where it sits,
Right.
right near your windpipe and your esophagus, right?
So breathing and swallowing.
Exactly. If the thyroid gets enlarged for whatever reason, it can start to press on those structures, and that can cause some serious problems.
Like what kind of problems?
Well, difficulty breathing, for one,
Huh.
and difficulty swallowing. You might feel like there's a lump in your throat or like you're choking.
That sounds pretty scary.
It can be. And it's one of the reasons why it's so important to be aware of your thyroid health.
So we've got this butterfly-shaped gland sitting in our neck, and it can get enlarged, potentially causing problems.
Right.
But what's actually going on inside the thyroid, like on a microscopic level?
Well, if you were to zoom in on the thyroid, you'd see these tiny spheres called follicles.
Follicle.
And they're packed with this protein-rich goo. It's called thyroglobulin.
Thyroglobulin. Okay. So what's so special about this thyroglobulin stuff?
Well, think of the follicles like little factories, and the thyroglobulin is the raw material that gets converted into thyroid hormones.
So the thyroid is actually making hormones.
Absolutely.
And these hormones, they're pretty important, right?
They're essential. And a key ingredient in the hormone-making process is iodine.
Iodine. Oh, like the stuff they add to salt.
That's the one. The thyroid needs iodine to convert that thyroglobulin into the hormones T4 and T3.
T4 and T3.
Yep, those are the two main thyroid hormones. T4 is kind of like the storage form, and T3 is the more active hormone that goes out and does its thing in the body.
Okay. So we've got these microscopic factories churning out hormones, and it all starts with iodine.
Pretty much.
But wait, there's more, right?
Mm.
I remember learning about these special cells, C cells, I think they were called.
You've got a good memory. Yes, C cells are found in the thyroid too, nestled in between those follicles, and they produce a hormone called calcitonin.
Calcitonin. And what does that one do?
Well, calcitonin helps regulate calcium levels in your blood, which is super important for keeping your bones healthy. It works together with the parathyroid glands, which we might talk about later.
So we've got the follicles making T3 and T4, and the C cells making calcitonin. It's like a whole hormone production center in there.
It really is.
But okay, let's zoom back out for a sec.
Sure.
We've got all these hormones being produced in the thyroid, but how does the thyroid know how much of each hormone to make? Like who's calling the shots?
That's where the brain steps in, specifically the hypothalamus and the pituitary gland.
The hypothalamus and the pituitary gland. Oh boy, here we go. Back to the brain.
It's all connected. So the hypothalamus releases this hormone called TRH, which stands for thyrotropin-releasing hormone. It's a mouthful, I know.
TRH.
And TRH signals to the pituitary gland to release another hormone called TSH.
TSH.
Yeah.
I'm trying to keep up. So we've got TRH from the hypothalamus telling the pituitary gland to release TSH.
You got it. And then TSH travels through the bloodstream and acts directly on the thyroid gland, telling it how much T3 and T4 to produce.
So it's like a chain of command.
Right.
The hypothalamus is the general giving the orders. The pituitary gland is the lieutenant relaying the orders.
Mm-hmm.
And the thyroid is the soldier on the front lines carrying him out.
I like that analogy.
And what's really cool is that there's this feedback mechanism built in.
Absolutely.
So when thyroid hormone levels in the blood are high enough, the hypothalamus and pituitary glands sense that, and they're like, whoa, slow down, thyroid, we've got enough.
Precisely. They reduce the amount of TRH and TSH they release, which tells the thyroids to ease up on production.
So it's like a thermostat. It keeps those hormone levels right where they need to be.
That's a great way to think about it. It's a beautiful example of how the body maintains balance. This negative feedback loop ensures that there's just the right amount of thyroid hormone circulating at any given time.
Okay, this is blowing my mind.
It is fascinating.
So we've got this whole intricate system controlling the production of thyroid hormones.
We do.
But why are these hormones so important in the first place? Like, what do they actually do in the body?
I think that's a great place to pick up next time. We've laid the groundwork. We've got the basics of the thyroid down. Next time we can dive into what these hormones are actually doing out in the body, why they matter so much.
Deal. Can't wait to explore that. Thanks for walking us through all of that. It's been super insightful. See you next time.
Sounds good. All right, so last time we talked about the thyroid gland, where it's located, how it's structured, and how it produces these crucial hormones, T3 and T4.
Right. We even touched on calcitonin, that other hormone the thyroid makes, which helps regulate calcium.
Exactly.
So now I'm really curious to dig into what these hormones actually do in the body.
Yeah.
Like, why are they so important?
Well, you can think of thyroid hormones as like the conductors of your body's orchestra. They're involved in so many different processes.
An orchestra. Okay, I'm intrigued.
They influence your metabolism, how your body uses energy. They affect your heart rate, your body temperature, even things like how your body makes proteins.
Wow. So they really are kind of conducting the whole show.
Pretty much. And they're essential for growth and development, too.
It's amazing to think that this one tiny gland has such a widespread impact.
It really is.
But sometimes things go wrong with the thyroid. We hear about conditions like hypothyroidism and hyperthyroidism. So what actually happens in the body when someone has one of these disorders?
Well, let's start with hypothyroidism. That's when the thyroid isn't producing enough hormones.
Not enough hormones. So it's like the orchestra is missing some of its instruments.
Yeah, kind of. Everything starts to slow down. Your metabolism takes a hit, which can lead to fatigue, weight gain, even if you're eating right and exercising.
So it's not just about the number on the scale, it's about how you feel.
Exactly. People with hypothyroidism often feel tired all the time. They might have trouble losing weight.
I can see how that would be frustrating.
Absolutely. And the symptoms can go beyond just fatigue and weight gain. You might feel cold all the time, even when other people are comfortable. Your skin might get dry and rough. Your hair could thin out. You might experience constipation.
Wow. So many different things can be affected.
And it can affect your mood and your thinking, too. Hypothyroidism can make it harder to concentrate. Some people experience brain fog or even depression.
Really? So this tiny gland can have a real impact on our mental health.
It can. It all goes back to the fact that thyroid hormones are crucial for brain development and function.
It's crazy how connected everything is.
And in severe cases of hypothyroidism, it can progress to a condition called myxedema.
Myxedema?
Yeah, this is where fluid starts to build up in your tissues and you get swelling, especially in your face, around your eyes. Your tongue can even get bigger, which can make it hard to talk.
That sounds really serious.
It is. Myxedema is a life-threatening condition that needs immediate medical attention.
So we've talked about hypothyroidism, where there's not enough thyroid hormone. What about the opposite? Hyperthyroidism.
Well, hyperthyroidism is when the thyroid is producing too much hormone.
Too much hormone. So now the orchestra is playing way too fast and loud.
Exactly. Everything speeds up.
Oh.
Your metabolism goes into overdrive, which can lead to weight loss, even if you're eating more than usual. Your heart might race or beat irregularly. You might have trouble sleeping.
It sounds like hyperthyroidism could be just as disruptive as hypothyroidism, just in a different way.
Absolutely. And just like with hypothyroidism, there's a whole range of symptoms. You might feel hot and sweaty all the time. You might have tremors in your hands, anxiety, irritability.
And there's that classic symptom of hyperthyroidism, bulging eyes.
Right. That's most commonly seen with Graves' disease, a type of hyperthyroidism where the immune system attacks the muscles and tissues around the eyes, causing them to protrude.
So with both hypothyroidism and hyperthyroidism, we see this wide range of symptoms, all stemming from either too little or too much thyroid hormone. It's incredible how this one gland can throw things so out of whack.
Yeah, it really highlights how important that balance is.
Okay, so let's say someone is experiencing some of these symptoms. How do doctors actually diagnose a thyroid disorder?
The first step is usually a blood test.
A blood test.
We can measure the levels of TSH. Remember, that's thyroid-stimulating hormone. It's the one the pituitary gland releases.
Right, TSH. It tells the thyroid how much hormone to produce.
We also measure the levels of T4 and sometimes T3 to see how much thyroid hormone is actually circulating in the blood.
Okay, so if TSH levels are high, that means the pituitary is trying to get the thyroid to produce more hormone, so that would indicate hypothyroidism.
Exactly. The pituitary keeps pumping out TSH when it senses that there's not enough thyroid hormone in the blood.
And if TSH levels are low, that would mean there's already too much thyroid hormone. So that would point to hyperthyroidism.
You got it. It's like the pituitary is saying, hey, thyroid, chill out. You're making too much.
Makes sense. So blood tests can give a pretty clear picture of what's going on with the thyroid. What about other tests, like imaging tests? Do those ever come into play?
Yeah, sometimes we'll use an ultrasound or a radioactive iodine uptake scan to get a better look at the thyroid gland.
Okay, what do those tests show?
Well, an ultrasound lets us visualize the thyroid, see if there are any nodules or other structural abnormalities.
The nodules.
Yeah, those are like lumps or bumps in the thyroid gland.
Are those always a bad thing?
Not necessarily. Most nodules are benign, meaning they're not cancerous. But it's important to get them checked out by a doctor to rule out any potential problem.
Okay, so ultrasound for structure. What about that radioactive iodine scan?
That one tells us how much iodine the thyroid is absorbing. That can be helpful in diagnosing certain conditions. Remember, iodine is crucial for the thyroid to make its hormones.
Oh yeah, those little factories. It all comes back to the factories.
It does. So yeah, doctors have a pretty comprehensive toolkit for diagnosing thyroid disorders these days. Between blood tests, imaging tests, and a good physical exam, we can usually get a pretty clear picture of what's going on.
That's good to know. But now I'm curious about the treatment side of things. Once someone is diagnosed with a thyroid disorder, what are the options?
Well, the treatment approach really depends on the specific disorder and how severe it is. For hypothyroidism, the standard treatment is levothyroxine.
Levothyroxine.
It's a synthetic form of the T4 hormone. It basically replaces what the body isn't making enough of on its own.
So it's like giving the thyroid a helping hand.
Exactly. And for most people with hypothyroidism, it's very effective in managing the symptoms.
That's great. What about hyperthyroidism? Is there a synthetic hormone replacement for that too?
Not exactly. For hyperthyroidism, we usually use medications that either block hormone production or slow down the thyroid's activity.
Okay, so it's more about controlling the overproduction of hormones.
Right. And in some cases, we might consider radioactive iodine therapy. That's where you take a capsule or liquid containing radioactive iodine, which is absorbed by the thyroid and destroys some of the cells that are producing too much hormone.
So it's a way to kind of shrink the thyroid without surgery.
Exactly. And it can also be used to destroy any remaining cancer cells after surgery for certain types of thyroid cancer.
Interesting. So medication and radioactive iodine therapy. What about surgery? When does that come into play?
Well, surgery is typically reserved for more serious cases, things like thyroid cancer, large goiters that are causing problems, or hyperthyroidism that hasn't responded to other treatments.
Okay, I can see how in those situations, surgery might be the best option. But I have to admit, the thought of thyroid surgery sounds a little intimidating.
I can understand that. It is a significant procedure. But in the right hands, it can be very effective and safe. And that actually brings us to the perfect topic for our next segment. We'll be diving deeper into the world of thyroidectomy, exploring the different types of thyroid surgery, the risks and benefits, and what the recovery process is like.
Sounds good to me. I'm ready to face my fears and learn all about thyroid surgery. Welcome back. So we spent the last 2 sessions getting to know the thyroid gland, this tiny but mighty organ in our neck.
It's amazing how much impact it has on our overall health. Right?
Totally.
Yeah.
And we've talked about those hormone imbalances, hypothyroidism and hyperthyroidism. And now we're going to tackle something that sounds a bit intimidating, thyroid surgery.
It does have a bit of a scary ring to it, doesn't it?
Yep.
But I think it's important to remember that surgery is often a very effective solution for certain thyroid conditions.
Right, like we talked about before, surgery is definitely on the table for things like thyroid cancer. But what about those benign conditions, like goiters that aren't cancerous?
Oh, yeah.
When would surgery be recommended in those cases?
So a goiter, even if it's benign, can still cause a lot of problems just because of its size and where it's located. If it starts pressing on the trachea, your windpipe, it can make it really hard to breathe. Imagine feeling like you're being choked, or you can't take a deep breath all the time.
I can't even imagine. That sounds awful.
It is, and if the goiter presses on the esophagus, it can interfere with swallowing, making it hard to eat. So in those cases, when the goiter is significantly impacting a person's quality of life, a thyroidectomy can really improve things.
It's not always about getting rid of a disease, but also about relieving those really uncomfortable symptoms.
Exactly.
Okay, so goiters and, of course, cancer. What about hyperthyroidism? When might surgery be an option for that?
So remember how we talked about those treatments for hyperthyroidism like medications and radioactive iodine therapy?
Yep.
Sometimes those treatments just don't quite cut it. They might not be able to control the overproduction of hormones effectively enough.
So for those more stubborn cases of hyperthyroidism, surgery could be the next step.
It could be. A thyroidectomy might be the best way to get those hormone levels back to a healthy range.
Okay, so we've got a better idea of why someone might need a thyroidectomy. Now let's talk about the surgery itself.
Sure.
What does it actually involve?
Basically, thyroidectomy is the surgical removal of all or part of the thyroid gland.
Okay, so sometimes they take the whole thing out and sometimes just a part of it.
Exactly. The extent of the surgery really depends on what's going on with the patient.
So what are some of the different types of thyroidectomies?
Well, like I said, there's the total thyroidectomy where they remove the whole gland. That's often the approach for thyroid cancer or for hyperthyroidism that just hasn't responded to other treatments.
Okay, total
Then
thyroidectomy.
there's a near total thyroidectomy.
They're total.
Yeah, so they leave a tiny bit of the thyroid tissue behind. That might be done if there's a risk of damaging nearby structures during surgery, like the parathyroid glands, which are super important for calcium regulation.
Right, we talked about those before.
And then there's the lobectomy, which is where they just remove one lobe of the thyroid.
Just one lobe.
Yeah, that's usually done when the problem, like a nodule or a tumor, is just on one side of the gland.
It's amazing how they can be so precise with these procedures.
It is.
But like any surgery, I imagine there are some risks involved with a thyroidectomy.
Of course, there are always risks with any surgery. But the good news is that most people who have a thyroidectomy do very well.
That's reassuring.
Mm.
But what are some of the potential complications?
One thing surgeons have to be really careful about is the recurrent laryngeal nerves.
The current laryngeal nerves.
They run right next to the thyroid gland, and they control the vocal cords.
The vocal cords. So there's a risk of damaging those during surgery.
There is, and that could lead to voice changes, or even in some cases, the loss of voice.
That sounds really scary.
It's a serious risk, for sure. But the good news is that skilled surgeons are very aware of these nerves, and they take extra precautions to protect them during the surgery. Permanent voice changes are actually pretty rare.
Okay, that makes me feel a bit better. What about the parathyroid glands?
Yes, the parathyroids. They're also very close to the thyroid, so there is a risk of damaging them during surgery.
And damage to the parathyroids could mess with calcium levels, right?
Exactly. It can lead to hypoparathyroidism, where the body doesn't make enough parathyroid hormone, and that can cause calcium levels to drop too low.
Which can cause all sorts of problems like muscle cramps and tingling.
You got it. But again, surgeons are very aware of this risk, and they take steps to protect the parathyroids. Sometimes they'll even do something called a parathyroid autotransplantation.
Parathyroid autotransplantation.
Yep, it's pretty amazing. They remove the parathyroid glands very carefully and then reimplant them in another location, usually in the neck muscles.
Wait, so they basically relocate those tiny glands?
They do. It's pretty incredible. And most people who have a parathyroid autotransplantation do very well.
Science is amazing.
Yeah.
Okay, so let's say someone has had a total thyroidectomy. What happens next?
Well, if the whole thyroid is gone, the body can't make its own thyroid hormones anymore, right?
Right.
So the person will need to take thyroid hormone replacement medication for the rest of their life.
Makes sense? It's like
Yep.
they're getting those hormones from an outside source now.
Exactly. And they'll need regular blood tests to monitor their hormone levels and make sure they're getting the right dose of medication.
Okay. And what about recovery after thyroid surgery? What's that like?
Most people stay in the hospital for a day or two after the surgery. There will be some pain and swelling in the neck, which is totally normal. Pain meds can help manage that.
So some discomfort is to be expected.
Yeah, but it usually gets better within a few days, and most people can go back to their normal activities within a week or two, though they might need to take it easy for a little longer if their job is very physically demanding.
Right.
The important thing is to follow your doctor's instructions and go to all your follow-up appointments to make sure everything is healing properly.
Sounds like the advancements in surgery and post-op care have really made a difference for people who need a thyroidectomy.
Definitely. We've come a long way.
Well, this has been an incredible deep dive into the world of the thyroid.
I agree. We've covered a lot of ground.
We've gone from the microscopic structure of this little gland to its big impact on the body, all the way to the complexities of thyroid surgery.
And we've learned that while thyroid disorders can be tough to deal with, there are effective treatments and amazing doctors out there who can help.
Exactly. And knowledge is power. The more we understand about our bodies, the better we can take care of ourselves.
I couldn't agree more.
So to everyone listening, if you have any concerns about your thyroid, don't hesitate to talk to your doctor.
Early detection and treatment are key.
Thank you so much for joining us on this journey through the world of the thyroid. Until next time, stay curious, keep learning, and be well.